Welcome to Pathology Wednesday. Today we'll go through 10 important pathology questions to test and expand your medical knowledge. Let's dive in and sharpen our understanding of diseases and their mechanism. 10 pathology questions. Today we'll be focusing on 10 questions about the pathology and pathophysiology of the cardiovascular system, specifically ischemic heart disease and heart failure. Now let's go through the questions on ischemic heart disease. Question 1. What is the pathophysiological cause of stable angina? Answer: fixed atherosclerotic plaque causing reduced blood flow during exertion. Myocardial oxygen demand exceeds supply, leading to transient ischemia. Question 2. What pathological change characterizes a vulnerable atherosclerotic plaque? Answer: a thin fibrous cap with a large lipid core and inflammatory infiltrates. Vulnerable plaque are prone to rupture, triggering thrombosis and myocardial infarction. Question 3. What happens to myocardial cells 20 to 30 minutes after complete ischemia? Answer: irreversible injury and coagulative necrosis. Lack of oxygen causes loss of ATP, mitochondrial damage, and cell death. Question 4. Why does subendocardial ischemia occur first during myocardial infarction? Answer: the subendocardium is the least perfused and most vulnerable to ischemia. It is subjected to highest wall stress and has fewer collateral vessels. Question 5. What gross pathological changes are seen 3 to 7 days after an MI? Answer: yellow tan softening with central necrosis. Macrophages remove necrotic debris, leaving a weak myocardial wall prone to rupture. So now let's go through some questions on heart failure. Question 6. What is the primary pathophysiological mechanism in systolic heart failure? Answer: reduced myocardial contractility leading to decreased ejection fraction. It commonly results from conditions like myocardial infarction or dilated cardiomyopathy. Question 7. What histological change is typically seen in chronic heart failure? Answer: myocyte hypertrophy and interstitial fibrosis. Hypertrophy compensates for increased workload while fibrosis reduces compliance. Question 8. What causes pulmonary edema in left-sided heart failure? Answer: increased pulmonary capillary hydrostatic pressure. Backward failure leads to fluid leakage into the alveoli. Question 9. Why is jugular venous distension a hallmark of right-sided heart failure? Answer: increased systemic venous pressure. Failure of right ventricle causes blood to back up in systemic veins. Question 10. What is the most common histological finding in cor pulmonale? Answer: right ventricular hypertrophy. Chronic pulmonary hypertension increases the workload of the right ventricle. That's it for today's Pathology Wednesday. I hope these questions help reinforce key concepts. Don't forget to like, share and subscribe to 10 daily medical questions. Keep learning, stay curious and see you in the next video.